During a preliminary consultation, the dentist will determine if a person is a good candidate for veneers by evaluating a patient's oral health. Veneers are an elective and often cosmetic dental procedure. With veneers, it is possible to correct small defects in the teeth. For its placement, the affected teeth must be prepared first. So, first, a thin layer of your tooth around 1 to 1.5 mm is buffed away to prepare your tooth for veneers. After that, digital scanning is performed to record the impression on your tooth for veneer procedure. The digital impression of the prepared teeth is sent to the lab. Based on scanning, you can alter the size, shape, and color of the veneers. As veneers are ready, you can see they only cover the front side of your teeth and slightly over the edges. Before the veneer is installed, your dentist will prepare your teeth and prepare the veneer. They will tailor everything according to your individual preferences, which you would have already gone during your consultation appointment. After veneers and tooth are prepared, they will bond it on your tooth. Oftentimes, they will need to use curing light to cure it into its place. Veneers are great because they can address your entire smile zone all at once. When you smile, you see this perfect looking veneer, but your natural tooth is totally behind it.